Number 11, redefining value in cancer care. 50 years ago, direct spending on cancer care was $1.3 billion in the United States. According to the latest figures, these costs ballooned to $124 billion, with expenditures projected to rise to $158 billion by 2020. The ever-rising price tag of cancer care impacts many stakeholders involved in our complex healthcare system, including providers, payers, manufacturers, and most importantly, patients and their families. If the economic costs of healthcare in general, and high-quality cancer care in particular, continue to rise unchecked, all healthcare will be less affordable for an increasing number of Americans. There is now an increasing emphasis on ways to assess the value of medical intervention and cancer procedures, more directly linking cost to benefit. Researchers are now working to provide clear and accurate information that helps patients make informed decisions about their care, empowers physicians to provide evidence-based care, and leads to innovative ways to encourage and reward best practices in cancer care. In the end, this will help improve cancer prevention, detection, and treatment in ways that will reduce the economic and human burden of cancer, ultimately leading to better outcomes for patients.
Thank you. And our expert for redefining value in cancer care is Dr. Tim Ferriss, who's a Senior Vice President for Population Health Management at MGH and Partners Healthcare. I've known Tim for many years, and he's the most calm, rational, and deliberate person on the face of the planet, and yet the Cancer Center is responsible for most of his headaches. So Tim, why are cancer drugs so difficult? Why do we give you so many headaches, and how are they different from all other drugs?
Well, thank you for this opportunity to address a really pressing problem. I do think that pricing of cancer drugs will be a disruptive force in the next decade. I think we will figure it out, or we will make progress in figuring it out. I don't think, fundamentally the dynamics that are at play in the pricing of cancer drugs are fundamentally different than the dynamics that have been at play for years in the pricing of drugs generally. But there are some special things about this time now. First of all, the stakes are really high, and everybody knows that. This is about a moonshot. A moonshot is expensive, and the acknowledgement of that goes into the pricing. I think also we have to acknowledge that the investment and the newness of some of the technologies, that we just heard about 30 seconds ago, is also part of the pricing issue. And then finally, I would say the speed with which these new things are coming to market at a time in which we understand that the costs of healthcare are one of the major national issues that we have to face. It's the confluence of timing that creates the appearance of a great tension. But as so many others are, and as I've heard here in earlier sessions, I think we have ideas about how to move forward in a pricing that gets all the stakeholders together, and we're going to make great progress.